the healthcare provider shortage and access to care. This Pecha Kucha will explore some of the reasons that have led to the healthcare provider shortage and a call to action on some of the things that you can do to hopefully improve this issue in the future. The U.S. healthcare industry is the largest and most powerful employer in the nation, accounting for more than 3% of the total labor force in the U.S. We also have some of the highest costs and spend more money than any other developed country when it comes to healthcare, obviously leading to a big issue. The demand for all types of healthcare services is expected to continue to increase as the population ages. Thus, substantial growth is anticipated in healthcare or related occupations. This is kind of a double-edged sword because we're needing more providers, but we don't have enough. We still have an issue with the number of providers available to see patients. Of course, other factors come into play. Several barriers can hinder patient access, including the ability to pay for patient care or transportation to a doctor's office. The newest barrier that's been emerging for a few years, though, is physician shortage, and that's making it harder for patients to see a doctor. The World Health Organization has defined a physician shortage as having less than 80% of the physicians needed to meet a provider demand. We have too many patients and not enough providers to see them. When there are healthcare provider shortages, patients are not able to access the care they need. Perhaps they can't find a doctor to make an appointment with, or once they do get an appointment, it might be a few months until they can get in. Then when they get there, they might have to wait a few hours to see the doctor. This not only impacts patient satisfaction scores, but it can also lead to negative health outcomes. According to the AAMC, the U.S. will face a physician shortage between 40,000 and 104,000 by 2030. Experts claim that the physician shortages are worsening because of population growth and an influx of older patients. The AAMC, which is the American Association of Medical Colleges and makes up a large percentage of physicians, has called on federal policymakers to help intervene and reduce the likelihood that those predictions will come to fruition. We'll start to explore some of the things that have already been done in order to help improve this issue. First, we must talk about healthcare providers. There are physicians and mid-level providers, which most of this Pecha Kucha will focus on, and then there's other providers as well that are listed on this slide. They're all important in the healthcare team, but we'll start to focus on the healthcare providers delivering direct access to care. Physicians, which are MDs or DOs, receive almost identical training. They includes 4 years of medical school, and then a residency, which can be 3 to 8 years, and then potentially a fellowship depending on their specialty. The only difference is DOs provide an additional training when it comes to the musculoskeletal system, and they have a slight philosophy difference, with DOs stressing preventive medicine and taking a more holistic approach to patient care. And then there's mid-level providers, which consist of NPs and PAs. They receive less advanced training than physicians, but they do not engage in the entire range of primary care or deal with complex cases requiring the expertise of a physician. It was actually in the 1960s when it was recognized that mid-level providers could provide access to care, especially in rural areas. Nurse practitioners are registered nurses who decided to go back to school and obtain a master's degree or a doctorate degree. States vary with regard to the licensure and accreditation requirements for this role, but compared to PAs, NPs are more oriented towards health promotion and education, whereas PAs are more oriented towards medical model that focuses on disease. Physician assistants also obtain master's degrees. They're licensed to perform medical procedures under the supervision of a physician who may be on or off-site. That's a little bit different than NPs, and interesting since their training level is identical. While the advent of mid-level providers has helped immensely, we're still facing a physician shortage problem. Other aspects include the training programs available for physicians. The residencies have been capped since 1997, and as you can see, there's a blockage between finishing a medical degree and obtaining a training program. The only change that's been made since then was in 1999 when the Balanced Budget Refinement Act was passed that increased the limit for rural teaching hospitals to equal 130% of the 1996 resident count. Since then, there's been no change in funding or change to the cap of resident slots. Now, in 2019, there were over 44,000 participants that registered for the match, and only 35,000 that were actually matched for a training program. That means we have over 9,000 applicants that went without a training position for this year, meaning they have a medical degree, but they're not able to use it yet. So how do we solve a complex issue like this? It's multifaceted, there's numerous factors at play, and how do we make it all work? It's not going to happen overnight, likely, and it's going to take years to work at improving the healthcare provider shortage. One of the things that I think we can first do is increase funding. It starts with creating policy changes that will help kickstart funding to help alleviate shortages that we're facing. Increasing funding to residencies program could create more positions and then help medical graduates obtain residencies so they can become licensed physicians. Another idea is building upon telemedicine, which has become a huge thing recently. Some places have implemented programs that allow specialists to consult with primary care providers in rural areas to provide a higher level of care. Additionally, virtual visits are becoming widely known, but the quality might be questionable. So how can you make a difference? Hopefully, through one of these lists, you might be able to find a way that you might start to help with the healthcare provider shortage, whether it's providing much needed public health services, helping to implement policy changes to increase funding, or helping on the ground level with community health education, promotion, maybe working at the Department of Health or the Center for Disease Control. It all starts with you.